Health and ambulance services, and the action I seek is urgent clarification on whether the paramedic practitioner program, specifically whether the government the future of the paramedic practitioner program, specifically whether the government intends to continue the funding for the program and restricting these highly trained professionals to working solely with Ambulance Victoria. Once again, I rise with deep frustration on behalf of the people of South West Coast who are watching their health service disappear by stealth. Our communities are suffering, our doctors are overwhelmed, new residents can't get a GP, even newborn babies are being turned away from clinics because there simply aren't enough practitioners. That's how overstretched the system is. This paramedic practitioner program was promised, heralded in fact by the Premier and the Minister, as a solution for the crisis in emergency departments and primary care. Legislation was introduced to allow paramedics to undertake advanced training so they could prescribe, suture, perform procedures and provide vital care that would keep people out of emergency departments and doctors' clinics. But now, in deeply troubling news, I've been advised that the Department of Health has paused or effectively defunded the project. Another Labor broken promise, another rug pulled out from under the hard-working professionals who have been studying, training and preparing to serve their communities. And it gets worse. The department's drugs and poisons section is acting against the advice of their own expert panel. They're proposing to restrict paramedic practitioners to Ambulance Victoria only, claiming that practitioners can only work safely within that organisation. That is deeply insulting to our general practitioners, hospitals, nurses, pharmacists and general health organisations who are needing of these extra skill sets. So why has the government defunded the program and why have they shackled paramedics to a single employer by legislation? No other registered health professional is treated this way. Why are paramedics being singled out? And the list of the Allan Labor government betrayals doesn't end there. We've seen the closure of the Portland helipad, cutting off a vital emergency lifeline for our region, a cut to a health service. We've seen cuts to the Warrnambool Hospital, shrinking what should have been a flagship regional facility. No new pathology, cuts to other essential medical facilities, and no associated improvements for car parking, catering or administration. We've seen delays and stalling on the promised drug and alcohol rehabilitation centre in Warrnambool despite the urgent need for support services. And we're still waiting for the PET scanner, a critical diagnostic tool promised in 2022. It's now 2025, and if we're lucky we might see it by 2027 if you believe what Labor says. This is not just mismanagement, it's hoodwinking, trickery and deception by the Allan Labor government. Something here is horribly wrong. This is a pattern of neglect, a pattern of broken promises, a pattern of treating regional Victorians as second-class citizens.